Okay, so this is a task for you. Simple task, not a very big deal.
Okay.
And I'm giving you 2 minutes. Make your plan.
Okay. Okay.
Yes, make your plan. Follow ready?
Okay, Dr. Priyata. Can you give me the questions?
Okay, questions has not been given. Okay, sorry.
Okay.
Yeah.
Start.
Yeah, you can start. I'm just
Okay.
keeping. Yeah.
Okay. Hello, I'm Dr. Khulud, one of the doctor in the clinic. Can I confirm your name and age, please?
Yeah, I'm Maria Jonas. I'm 27 years.
What would you like me to call you?
Maria will be okay, doctor.
Okay. Okay, Maria. Maria, I understand that you are here today because you have some concern before your period. Am I right?
Yes, doctor.
Maria, this is the first time to see you, so can I ask you a couple of questions to know more about you, and then may need and examine you in the presence of a chaperone, and may need run some investigations for you, and finally go with you through the options available for you, and we will write down to your GD to inform him, and finally I give you written information to know more about your problem. How does sound for you?
Yeah, that will be great, doctor.
Okay. Maria, can you tell me more about your problem?
Yeah, doctor. See, before like my periods, I feel I do have mood swings. I feel tired, lack of energy, and it is very difficult. I can't concentrate on my work.
I'm sorry to hear that about you, Maria. So I can see how affect your life. So what about your job? What do you do for a living?
Yeah, I am this secretary to a dentist.
Yeah. Do you feel that affect your job?
Yes, sometime I had to take leave, and I think that he will fire one day. I will be fired one day from my job.
Mhm. How do you feel about when the period started? Still you have this pain or just finished when the period start?
Yes, doctor.
Mm-hmm.
Yeah, please
You
repeat
I
question.
mean that, okay. I mean, Maria, when the period started, you still feel this pain, or just the period started, the pain will be finished?
Yeah, but after once period start that I become completely okay, doctor.
Yeah. Okay. Do you have other symptoms with this other than feel bloating or this, or distressed, or
Yes, I
like
do.
pain in the breast? Mhm.
Yes.
You feel this? Okay. Did you have any treatment for this before, Maria?
Yeah, I do tried so many some sort of this herbs I have taken, and also I was taking some vitamins for that. So I took all this type
Mm-hmm.
of medication, but nothing seems to be worked out.
Mm-hmm. Don't worry, Maria. We will help you as we can. Maria, can you tell me about your period? How many days is regular? Any bleeding in between periods?
No, my periods are very regular, doctor. There had been no issues with it, and my last period was like 1 week back.
Yeah. Are you in the sexual relationship, Maria?
Yes, I'll be like marrying next month.
Yeah. Congratulations for this, Maria.
Thank you.
So, okay. Maria, do you have, okay. So, you notice that there is any masses in your tummy, feel loss of weight in the last months?
No, not that. That thing is not there, doctor.
What about your bowel, your bladder, water
Yeah,
works?
yeah. But there have been no issues with my bowel and water works has been okay.
Okay. Maria, what about your smear?
Yes, a smear. I had one smear, then that was okay.
Yeah. Positive?
No, it
Okay.
was fine, normal.
Okay. Maria, have you ever get pregnant before?
No pregnancies, doctor.
Yeah. Any contraception before?
Just we use condoms.
Yeah. Okay. Maria, any health problem do you have apart from this?
No, no, no. There had been no issues.
Any medications right now?
No, no, no medication.
Any allergy at all?
Allergy? No, no allergy.
Do you smoke or drink alcohol at all?
Yeah, because this puts me under so much of stress. So sometimes I smoke.
I understand how this affects you, but Maria, if you try to stop or even reduce smoking, it will improve your condition. Are you with me?
Yes,
Okay. So if you ever thought to do this, I can put you in touch with smoking cessation line. Okay, Maria?
yes, doctor.
Okay. Maria, do you feel that in the last 4 weeks feel low or loss of interest in doing things?
Yeah, I already told doctor, so I'm too much of under stress because of this problem.
Mhm. If you want, Maria, I can put you in a counselor to help you in this issue. It's okay with you.
Yes.
Okay. Do you want to ask to tell me any information you feel that important?
No, it's okay, doctor.
Okay. Thank you for sharing this information with me. And now I want, are you aware of your weight height ratio?
Just 24.
Okay. I wanted to examine you generally to check that you are generally fit and well, and may need to your vitals and may need blood pressure, pulse, and also may need to examine your tummy, any masses, any tenderness, and also in presence of a chaperone, may need to examine you do internal examination to check if there is any infections, any discharge. Okay.
Yes.
Okay. As by these investigations, when we don't found a cause, most probably to what is called premenstrual tension syndrome. Ever heard about it, Maria?
No, doctor. What is it?
It is condition may affect some women that may feel a problem before menses, and when at the third day, mostly the third day, this tension will be improved. This means there is many theories for this, maybe disturbance of hormones. That cause actually not known, but there is many theories maybe to be this. Am I clear so far, Maria?
So, yes, doctor. So, why actually it happens? Why it happens?
That I told you, Maria, there is me some factors. They call this due to ovulation, when the releasing of the egg may release some hormones. These hormones, which is called progesterone, may affect the hormone which affect the brain, like what is called the serotonin. This all hormone affect the mood. There is relation. They found some relation between these. Am I clear so
Oh,
far?
yes, yes.
Okay, in this condition, first we wanted to do some lifestyle modifications, like improve our food, healthy food, like increase fruit, decrease, stop smoking, do exercise, and also what is called cognitive behavioral therapy. Did you heard about it?
No.
This is some session. You will stay with like a counselor or counselor or psychological, not psychotherapist, but like a session. You try to change your mood about your problem to think better about it. Am I clear so far?
Yes, 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 doctor.
After that, we try. I want to be sure that do you have any history in the family of blood clot like this or any problem, Maria?
Yeah, my
Okay.
father had,
So, yeah,
yes, my father had clot when he had done hip operation.
yeah. The first option is contraceptive pills, but from the problem or the that may be lead to clots. Where may I will consult I ask my consultant for this before prescribe this you before you have a history for your father to have these clots. Then we give you some. After this, we try. If it is failed, we can give you also antidepressant drug for about 10 days in low dose. If not improve, we can take another medications like estrogen patches and give you coil to protect your womb from any effect of this estrogen. The other thing, if not this will acting with you, we have another medication, what is called GnRH. This is injection given monthly, but the problem may lead to menopausal symptoms like you feel hot flashes and sweating, and not be used better to be used more than 6 months. And if used with this more than 6 months, we can give another medication to protect you and protect your bone. Am I clear so far?
Yes, yes. Your time finished, Khulud. 30 seconds back.
Okay. Okay. The last option is the surgery, but I think it is not for you. It is the removal of the ovaries, and I think it is not be an option for you because I think you are starting your life. Am I right?
Yes, yes.
Okay. Do you want to ask any question?
No, it's okay, doctor.
Okay, I will give you a patient information leaflet and I can fix an appointment with my consultant if any other concern. Thank you for your time.
Thank you. Okay, well done, Khulud. But you took 12 minutes, complete 12 minutes to do this station. and
Mm.
so you have to wind this station within 9.5 minutes, because for 30 minutes seconds just you keep for anything. So you have to like
Mm.
work on this part. 2 minutes, 2.5 minutes you have to take less. One thing. Second thing, you history taking was like for 7 minutes. You have to reduce the time in the history taking. Fine.
Yes.
These are the two
Yes.
important things I wanted to tell you. And though you have done well, just a little bit of things I want to add here. Um, in the information gathering, pain and periods, so there could be two things, either PMS or endometriosis. You know you are dealing with PMS only, but you have to ask some question with regards to endometriosis. So important, rest of the history will be same, but you have to ask whether she has got any pain during sex. Okay, so dyspareunia history you have to
Mm.
take here, because
Mhm.
examiner will know you are doing this differential diagnosis for endometriosis. So this is important thing you missed. Second important thing, this patient, she gave you a hint that she is going to marry next month. So but you didn't pick up that hint. So she wanted to start with so that time. You have to ask, so what about your for baby plans and all. So she wanted to start her family immediately after getting married, like after 1 month or 2 months she's getting married. So yeah, unless you ask her this question, she's planning for pregnancy in near future. So you
Mm.
will miss the station bit, because this being an exam recall station and she wanted pregnancy. So if you ask this question, then you won't be giving any sort of hormone. Okay, so this
Mhm.
is also
Okay.
important point you need to ask. And in this station, whenever you are doing any type of station where you are giving this OC as a OCP pill, you will be giving as a treatment or any sort of hormone. So you have to find out contraindication to that in the information gathering domain. You cannot ask later on before giving OCP. Okay, now tell me this. So you that part has to be completed in the information gathering domain. This is another feedback. Another third thing, this type of patient, this PMS patient, too much of depression and mental health issues are there that you address. That is a very nice thing you have done. Fine. Now and also in the, you have to, in this station it is very important, you have to say, so putting all these things together, I do have a um, this concern, like you may have this problem, but for that I would give you handout of this menstrual diary, or so that you can record this for 2 months. Then you'll be able to just confirm that you are having same thing. So you never give any like handout for menstrual diary, or you have to say, have you kept any record of that, or have you maintained any diary. So you have to bring this in the picture, and you have to say it very clearly. We do usually we do it by keeping record. We do not have any sort of blood test for it. Okay, there is only one investigation. So you have to bring this in a picture. Fine, Khalud. Khalud, are you listening? Khalud, are you listening? Am I clear? Am I clear? People are, am
Yes,
I audible?
yes, yes, yes.
Okay. Okay, Khalud. Now I will give you a complete answer to this question. So in the information gathering domain here, you can put two differential diagnoses. One will be PMS, another will be endometriosis. So what you have to ask up, you need to ask her about her mood, any depression, anxiety, tiredness, sore or tender breast, and feeling bloated, and what type of treatment she has taken, and what the impact of this condition or life at work or life at home. So this information you have to gather about the presenting complaints, and also you have to ask, like Khulud did, whether she become a completely normal person once her periods are there. Okay, so this type of information gathering. Then gynae history, you have to ask period details, LMP, smear, contraception, and also it is important to ask for future fertility, because she is planning pregnancy immediately after getting married. Then you have to ask in all gynae stations, general gynae module, we ask about bowel, bladder, and intercourse, and whether anyhow or they are affected in the any station you are doing. Like in this station, it is important to ask about painful sex. Then obstetric history, you need to ask whether she has been pregnant before. Then medical, she asked very well, but in the medicine here only, you have to ask whether she has taken any, whether there had been any previous history of any heart disease, any clot, or there had been any
Hello?
breast.
How,
Yes,
hello? I'm
yes.
sorry, Priyata, I lost connection. I lost connection when you start speaking about she is severely depressed.
About
I lost the connection when you started to speak about the patient was severely depressed. So can you repeat, please?
from gynae history.
I lost the sentence. I heard from you that when you speak the patient complaining of severe depression. So after that, I missed the connection.
Okay, so the gynae history is important. Asking about period detail, LMP smear, if she, because she is 27 years old, contraception she has used, and what are her future plans for pregnancy. Then after it is important in all the station of the general gynae module to ask whether the present problem is affecting their bowel function and their sexual function. So this was important. There is some voice from some side. Please mute your microphones. Okay, and so this was important in all general gynae patients. After that, obstetric history, whether she has been pregnant before. Then medical history is important. Medical history will be whether she has taken any sort of treatment for depression, because in PMS and depression these are correlated. And then you have to ask whether there had been any problem with the heart, heart disease, clots, or there had been any breast cancer, and any allergy, because this you are doing ruling out any contraindication for contraceptive pills she is already having. Then surgery history is important. Family history is clot and heart disease, that has to be asked here only. Then social history is social smoking, alcohol, and drugs. Usually, this patient will be like depressed patient, so they will be smoking at all. That time, you have to say, okay, this smoking also worsen the situation. If you think of quitting the smoking, that you may feel beneficial effect on your health immediately. In the NHS, we do have a stop smoking services. If you wish, I can give you contact details with them. So she will say yes. After that, diet, you can ask if she's taking too much of spicy food and all, because it do have certain correlation. So that's all about information gathering details domain. Am I clear? Follow the word information gathering.
Yes, yes.
After this examination, we'll be checking for her general health, blood pressure, and BMI, and also abdominal examination to check for sort of any, whether she is bloated right now or whether she has got any painful area. And coming to investigation, you have to say that in that, have you ever kept of this record of your symptoms in relation to your period menstrual diary, or otherwise I will give you handout of this the menstrual diary so that you can record it. That will be better to diagnose the condition, and also to find out whether whatever the treatments we are offering, it is working or not. Okay, now you need to start with applied knowledge domain. So you have to give them very clear idea. So because they want explanation of the diagnosis in a clear simple words. Putting all this putting all your things together, Maria, I do have a like a suspicion that you are having this premenstrual syndrome. Any idea? She will say no. So this is a condition where you do have it is a sort of a syndrome where you have some physical symptoms and some emotional symptoms, and these symptoms, they start 2 weeks before your period, and you are a completely normal better person once the period start. And so I'm suspecting that you are having severe form of it, because if the 100 women will have PMS, 2 to 4 out of them will have a severe kind of it. Am I clear? She will say yes. After that, she will ask why it happened, or you have to explain why it happened. So what the like research has shown, there is a too much of because the ovary it releases egg every month. Because of this, there are so much hormone fluctuations, and these fluctuations in the hormone, they also affect some. There are certain chemicals in our brain, and some of the women, they are more sensitive to it. Therefore, all the symptom may happen. So, am I clear? She will say yes. So, in this way, you have explained in very simple words that because of release of egg, there had been fluctuations in the hormone. And these fluctuation of hormone affect chemical in the brain, and some of women are more sensitive. Therefore, they feel all the symptom. So, this is the clear explanation of her symptom, that what she's facing. After that, you have to say, am I clear? She will say yes. Then to help you in this situation, we do have certain options: making changes in your lifestyle, certain sort of medications, and also some sort of therapies. And we consider even the surgery is there, but we consider that as a totally last option. I would be giving you information about all of those, and I would balance the risk and benefit. Whatever you decide, I'll support you in that. With this type of statement, then you start. So, Maria, considering changes in your lifestyle, like doing sort of exercises, taking healthy food, avoiding all this spicy food, and just quit smoking, and reducing down stresses in your life by doing meditation and yoga. What the research has shown, this going to taking steps towards this, making your lifestyle healthy, has an impact on your general well-being, and also it may help improving your symptoms. Am I clear? She will say yes. After that, so Maria, I can see that your life is quite affected because of these symptoms. For your psychological symptoms, we do have a type of therapy. This is this is cognitive behavior therapy. This is sort of a therapy, Maria. It is a type of talking therapy where there is an expert person, counselor. He will talk to you on one-to-one basis. That may help you just change the way you think and the way you behave, and to finding out the positive ways to cope with the situation. Am I clear? So she will say yes. Apart from this, we do have certain medication that will be given by the expert, and these are like we in the medical term, these are SSRI, antidepressant medication. But if this be given usually in the low doses, and if we offer you this type of medication, you may feel sick, there will be difficulty in sleeping, and you may have like low libido or the lack of interest in the sex. And this with this type of medication, now you have to explain mechanism. So as there had been so this type of there are certain happy and sad chemicals in our brain, and this medication, they just cause balancing of those chemicals. So this way, this will affect your psychological symptoms. um, Am I clear about it? She will say yes, but in the exam, see, after explaining this, she said, "No, doctor, I don't want this this type of medication. I'm happy doing this lifestyle and this counseling." So in the exam, this way happened. Then after that, you have to say, with Maria, in this situation, for the physical symptoms, we offer some type of hormones. These are combined hormones that can be taken like back to back or with a braid. There are some patches, gels, and injections are there. So we do all these type of treatments are there, but all of this they work. These hormones, they work by stopping release of egg from your ovary. And in your case, Maria, as you are looking forward to plan for pregnancy, so I'm really sorry. At all these options, I won't be able to offer you. So this way, oh, then she said in the exam, after saying this, then she said, "Doctor, okay, what about there are certain some sort of herbs and complementary therapies?" Then the answer was yes. There are certain alternate and complementary therapies are there, and she was taking some herb also. So you have to say, okay, you can. We do have certain alternative and complementary therapy, and also there had been a herb. You, if you are happy continuing with that, you can continue with that. But we do have limited evidence to show that these are effective. So in the exam, they were looking for this type of answer. So you can continue with that. There are therapies, but there is little evidence to show that they are effective. After that, she kind of was very happy, and after then just sum up of the station. Anything else you any questions? She said no. Then you have to say okay. So as you are planning for your pregnancy and getting married, so congratulations. So I will you can change for your lifestyle. I will put you in touch with counselor, and also you can continue with your this complementary therapies. And I will give you some written information. I will have a word with my consultant about you, and I will give you the written information and this referral to and the support groups, and give and I would give you this for this handout for the menstrual diary. You can record it for 2 months, and if there had been any concern, then you can see me at any time. So this will be like closing of the station. Am I clear, Khulud, about this?
Yes, yes. Thank you, Priyata. Thank you very much.
So, unless you ask that she is planning for pregnancy, then your counseling part will be changing. Okay. If she says, okay, I don't want for plan for pregnancy, then you have to explain that hormone in details. If she says,
Yes,
I'm planning for pregnancy, in that situation, you have to say, okay, we do have certain combined hormones, some sort of patches and gels, some sort of injections, but all they work by stop releasing egg from the ovary. And you are planning for pregnancy, so I'm really sorry, I won't be able to offer you them. So you will get complete marks in applied knowledge domain. Am I clear?
yes.
Okay. Any question, Kholu?
Thank you, Priyata. Thank you very much.
Anyone, any question? Anyone, any question? Okay, if no one has question, then I'll be closing. Anyone has any question, then please ask. Otherwise, I will be closing. And I wish you best of luck to see you in this frame.
Okay,
And
thank you, Priyata, for your such a nice session.
thank you for attending. All of you, thanks.